So hi everyone, my name is Jamie and on behalf of Lung Foundation Australia, I'd like to welcome you to today's webinar. Before we begin, I would like to acknowledge the traditional owners and custodians of country throughout Australia and recognise their continuing connection to land, water and community. I pay my respects to all First Nations people and acknowledge elders past, present and emerging. So today's webinar will provide some insights into the role of diet and nutrition in the management of your lung condition. And I'd like to thank the Centre of Research Excellence in Pulmonary Fibrosis for their continued support in holding these webinars. So I'd now like to introduce our speaker for today, Christy Emsley. Christy is an accredited practicing dietitian who has experience working in private practice, nursing homes and hospitals, whilst specialising in respiratory nutrition at the Alfred Hospital. She has been involved in a study aiming to prevent weight gain amongst lung transplant recipients and has published an article evaluating malnutrition among lung transplant candidates. So we're very grateful to have you joining us today, Christy, and present and answer some of our questions as well. So when you're ready, I'll hand over to you to get started.
Thank you. Hello everyone and welcome. Thank you for joining me for today's presentation on nutrition in pulmonary fibrosis. I'll be referring to pulmonary fibrosis as PF sometimes. So as Jamie mentioned, I have worked for about 5 or 6 years in respiratory nutrition at the Alfred Hospital. Mostly within the role was involved with working with people pre and immediately post lung transplant, and about a third of these patients had interstitial lung disease, and that included PF. So I have a fair bit of experience in that. But what I did want to point out is that the research and guidelines in this area on nutrition in PF is quite scarce. So I have taken some examples of other lung conditions like chronic obstructive pulmonary disease or COPD and other general nutrition principles where needed. But the good news is it is a growing area of interest, so there is more and more research in this area each day. Another thing I just wanted to highlight is that nutrition is very individualized. So we all come from different sociocultural backgrounds, we all have different taste preferences, and for some of us, we have different medical conditions called comorbidities. So what I've got listed here is common comorbidities in pulmonary fibrosis. And about 60% of people with PF have 1 to 3 comorbidities, and about 30% of people have 4 to 7 comorbidities. So the ones in which nutrition plays a role is things like reflux, high blood pressure, high cholesterol, and diabetes. So it may be that you need more specific recommendations to, I guess, target each of those individually as well as the PF as well. So it's just another thing to consider. But the main things I'll be looking at today are reducing excess weight, managing side effects, and preventing malnutrition. And I've put them in this order, I guess, of the nutrition spectrum from diagnosis through to end-stage disease. So when we talk about reducing excess weight, we're really talking about reducing excess fat mass rather than excess muscle mass. However, it's very difficult to differentiate between the two unless you have special machines and scales. So for most people, what we look at is body mass index or BMI, which some of you may have heard of before. So calculating your BMI involves your weight and your height. So it's your weight in kilograms divided by your height in meters squared. So if you were 95 kilograms and 178 centimeters or 1.78 meters tall, your BMI would be 30. So if you can't do this with a calculator at home, what you can use is the Heart Foundation website link that I have there, or otherwise just Google a BMI calculator and it should come up with something. So that the BMI that you calculate can be classified according to the World Health Organization. So a healthy BMI is considered 18.5 to 24.9 kilograms per meter squared. So if you are over 65 years of age, a BMI over 23 is also considered healthy, as it is associated with reduced mortality. However, keeping in mind that a BMI greater than 30 or obesity is not something that we aim for. In terms of PF, it reduces your lung function and increases your shortness of breath, particularly if the weight is central, so around the stomach. So another thing that we look at is waist circumference, and the Heart Foundation website also has links to what your waist circumference should be, whether you're male or female, and how to reduce that as well. Another reason that we try and keep your BMI under 30 is that it's a contraindication to lung transplant. It's associated with an increased risk of mortality. So for all of these reasons, we would recommend keeping your BMI under 30 and reducing your weight, and particularly your fat mass. So how to do that? We know that studies among people with COPD have shown that a combination of diet and resistance or weight training improves BMI, exercise tolerance, and health status whilst preserving muscle mass. So the key is to finding that right balance. When we talk about losing weight, we need to use more energy than we consume. So the ways in which we use energy are through everyday activities like breathing, digesting food, and even sleeping. But to increase our energy expenditure, we need to increase our physical activity. So when we talk about that, it can be incidental. So for example, walking to the shops instead of driving, or it can be planned exercise. So that could include something like golf or a home-based workout. So I would recommend that you see a physiotherapist or an exercise physiologist to develop a plan for you and your symptoms, injuries, and any medical conditions that you have. In terms of diet though, to reduce our energy intake, we should reduce our intake of energy-dense food and drinks. So fat is the most energy dense item that we have. So to lose weight, I would recommend reducing things like deep fried food, pastries, chocolates, biscuits, fatty meats, cream, things like that. They're all types of bad fats or saturated fats as well. Alcohol is the next most energy dense item that we have. So it does provide energy, but it doesn't provide any nutritional value. So for that reason, I would also recommend cutting down on alcohol or cutting out altogether. And finally, sugar is the next most energy dense food or drinks. And it also, a lot of the items that are high in sugar have no or minimal nutritional value. So things like lollies and soft drinks. So they're another product that I recommend to cut down on. So I've talked about what not to have, but let's look at what you can have or should have in your diet. So dietitian recommendations are often based on the Australian Dietary Guidelines, and you can find those at this link here. The guidelines separate food into 5 different groups, so vegetables, fruit, meat and alternatives, dairy and grains. So each food group has a serve size, which you can see here in both pictorial and written format. And the recommendations suggest how many serves a day you should have of each food group based on your age and gender to meet all of your nutritional needs. So if we look at vegetables, we should all have between 5 and 6 serves of vegetables a day. However, less than 10% of Australians actually meet that guideline. So that's one that I often recommend to increase, particularly for weight loss. And we all need about 2 serves of fruit a day. And interestingly, there was a study that found that fruit intake was associated with a reduced risk of pulmonary fibrosis, while intake of meat and saturated fats had an increased risk of the disease. The Australian Dietary Guidelines also recommend 2 to 3 serves of meats or alternatives each day. So alternatives, we're talking about things like baked beans, legumes, lentils, and tofu. What's important to note here is that the serve size of cooked meat is only 65 grams, and the serve for cooked poultry is 80 grams. And this is much smaller than the average Australian serves. And this is an area where you could cut back on to if you're worried about weight management. The guidelines also suggest between 2.5 and 4 serves of dairy a day, which is really important for bone health, and between 3 and 6 serves of grains a day. So to ensure that you get all the nutrition you need, what I would recommend doing is developing a meal plan, whether that's at the start of the week when you're doing things like food shopping, and ticking off each food group serve as you write that down for the day. So that's an easy way to make sure that you're getting all that you need and filling up on those things that you need. So avoiding those high energy or discretionary items that we had on the previous slide. However, if you don't enjoy planning in advance or counting foods, a simple tool you may like to use is what's called the portion plate that you can see here. The plate is divided into 4 quarters. Half of the plate should be non-starchy vegetables, so that doesn't include potato, sweet potato and corn. These vegetables would be included in the carbohydrate portion of the plate, which also includes things like rice, pasta, noodles and bread. And the final quarter should be a source of protein like meat, poultry, fish or tofu. And at least 2 of your meals per day should look like this. The remainder of the day can be filled with other meals and snacks that meet your other food groups like fruit, dairy and grains. So a typical day could look something like this. A number of studies among people with COPD have found that a healthy diet, including fruits, vegetables, fish and whole grains, protects against lung function decline, whilst an unhealthy pattern of refined grains, cured and red meats, desserts and French fries has the opposite effect. So what this touches on is the importance of diet quality, not just diet quantity. So for example, we would recommend choosing fish over processed meat like bacon and whole grain bread over the white varieties. And if you'd like any more information on the Australian Guide to Healthy Eating or label reading, I would recommend watching the Eating for Healthy Lungs webinar at this link here. So moving on to managing side effects. Common symptoms of PF include breathlessness, dry mouth and fatigue. Strategies to limit the impact of these symptoms are listed in the right-hand column, and as you can see, many of them overlap. Shortness of breath can make chewing and swallowing more difficult. You may find that soft, moist foods and liquids are better tolerated. For example, mashed potato, minced meat, and fruit smoothies. Although drinking may be easier, it is important to ensure that the drinks are providing you with enough nutrition, and a dietitian can help with this. Due to the increased time it takes to eat meals, you may find it easier to have smaller portions and add snacks rather than having 3 large meals each day. And to help reduce breathlessness, wear supplemental oxygen when eating if recommended for you, and rest before and at least 15 minutes after meal times in an upright position. Dry mouth can be caused by supplemental oxygen use and a high rate of breathing. Again, soft, moist foods and liquids may be better tolerated. And to increase saliva production, try sucking on board lollies, lozenges, ice or ice blocks, or chewing gum. And for dental health, I would recommend choosing the sugar-free varieties. And if these strategies aren't effective, chat to your doctor about mouth sprays, gels and rinses that may help. So fighting fatigue has similar strategies to those involved for breathlessness. So having small amounts but often, choosing soft moist foods and liquids, and resting before and after eating. Additional tips are to stock up on quick meals and ingredients such as frozen meals, tinned products like tuna and soup, and things like microwave rice. And if possible, use a meal or grocery delivery service and ask friends and family for help with shopping and cooking. So some people may be prescribed steroids such as prednisolone or dexamethasone, which may cause side effects that impact your nutrition. So increased appetite and the risk of weight gain is really common. To avoid gaining weight, I would recommend following the healthy diet that we've outlined today and discuss and implement an exercise program regularly. Steroids also increase blood glucose levels. So for those with diabetes, this can mean worse control. And for those without diabetes, it can increase your risk of developing the disease. So to reduce the impact, I would recommend limiting sugar, such as lollies and soft drink, and using the portion plate to guide meals. Your doctor may recommend a blood glucose monitor, or at least check your levels regularly. Steroids reduce calcium absorption, so the need for calcium from your diet is increased to prevent or reduce the severity of osteoporosis. Most people need 3 to 4 serves of dairy a day, as well as potentially a calcium supplement. And you may also benefit from a vitamin D supplement, as this nutrient works with calcium to promote bone health, and it is rarely found in food. Regardless of steroid prescription, 20 to 40% of people with PF have a vitamin D deficiency, and this has been linked to an increased risk of mortality. So it may be worth getting your vitamin D level checked with your GP. You may be prescribed an antifibrotic called pirfenidone or nintedanib. So these medications can have unwanted side effects such as nausea and vomiting, diarrhea, and poor appetite. The strategies to manage these symptoms are similar to those for the general PF side effects. So for nausea and vomiting, having small amounts often, and avoid skipping meals, as this can make nausea worse. Choose cold or room temperature food and drinks. Choose dry foods like toast and crackers. Choose ginger and peppermint things like tea. Avoid strong smelling and tasting food. Avoid spicy foods like curries, and avoid fatty foods. Particularly with vomiting, it's important to ensure you stay hydrated, and most people will need around 2 litres of fluid a day. Take antifibrotic medications with or at the end of a meal. And finally, discuss anti-nausea medications with your doctor, such as metoclopramide and ondansetron. So for diarrhea, the strategies are fairly similar to the nausea and vomiting, but you may also wish to limit caffeine, so things like coffee and alcohol, as these increase your gut transit time. And if none of these strategies work, discuss anti-diarrhea medications with your doctor, such as loperamide or Gastrostable. So for poor appetite, have small amounts but often, stock quick meals and ingredients, and have nourishing fluids. Although avoid drinking with meals, as you may fill up on drinks, and avoid important nutrition with food. So as you can see, these symptoms reduce your ability to eat and drink enough, and weight loss is relatively common. About 30% of people taking pirfenidone lose more than 5% of their body weight in a year, while over 60% of people taking nintedanib experience the same amount of weight loss. Although regardless of antifibrotics, 20% of people with PF lose more than 5% of their weight following diagnosis, even without antifibrotic treatment. This leads us to malnutrition. So malnutrition is the inadequate intake or absorption of nutrition, leading to weight loss, low BMI, low muscle mass, and or reduced body function. I'm just going to turn this light on. So like weight loss, low muscle mass is common among those with PF. Over half of people with PF waitlisted for lung transplant have low muscle mass. However, only 5% of people are underweight. So what this highlights is that low muscle mass can occur at any BMI. So why is preventing malnutrition important? Most importantly, muscle mass in PF increases survival. We know that patients with greater weight and muscle loss have greater deterioration in lung function, and that muscle weakness of both respiratory and skeletal muscles contributes to a reduction in physical activity. This leads to further deconditioning. And impaired strength and function in PF has been linked to poorer health outcomes and reduced quality of life. The good news is that muscle dysfunction is partially reversible with optimal nutrition and early exercise, such as pulmonary rehabilitation. So how can you prevent malnutrition through your diet? Firstly, eat and drink small amounts often. It's a good idea to eat to the clock, so for example, every 2 to 3 hours. Maximise your intake at the time of day when you feel best. Choose full fat products such as milk, yogurt and cheese. Fortify meals and snacks with fats such as oil, avocado, nuts and seeds, or less healthy fats like butter, margarine, cream and cheese. You can fortify with sugar, although just remember it has less energy than fat. At mealtimes, prioritise protein, so meat, chicken, fish and eggs, or legumes, lentils or tofu, and also dairy. Have these over low protein foods such as salads, vegetables and fruit. Choose nourishing drinks such as fruit smoothies and milk drinks, or milk alternative drinks if you don't drink milk. Have these over lower energy drinks like water, tea, coffee and cordial. Avoid drinking with meals and make meals a social and enjoyable occasion. If your weight is still dropping, I would suggest a supplement drink such as Sustagen or Ensure, and you can get the powdered versions of these from chemists, and they are often cheaper than the pre-made Tetra Paks. One of the main areas in which I assist people with malnutrition or preventing malnutrition is advising on snacks that are both high in energy and protein. So you can see examples here from liquids at the start down to more solid foods at the end. And although I've listed some products with brand names, I just wanted to point out that they have no affiliation with myself or Lung Foundation. So at the top, we've got ready-made milk-based drinks, or in this case, a milk alternative drink like Up and Go. And these ones are really good for a portable snack. The next is milk-based drinks, or like milkshakes or smoothies, such as Milo. The next one we've got is yogurt, particularly high-protein yogurt like YoPro and Chobani Fit. And then custards, either with or without something like tinned fruit. And then bread, toast or crackers with high energy dips such as hummus, pesto and cream cheese. Things like peanut butter, cheese, avocado and boiled eggs. A handful of trail mix, so something like nuts, dried fruit and chocolate. And then a nut-based bar or muesli bar. To assess your progress, monitor your weight, how your clothes are fitting, and your strength and function at least weekly. If you're doing most of what we've discussed today and you're still losing any of these rapidly, I'd recommend that you see a dietitian. You can get a Medicare plan through your GP to receive rebated sessions. From there, you can ask your respiratory physician if they have a dietitian linked with the service. Otherwise, you can find one through the Dietitians Australia website. Go to the Find an Accredited Practicing Dietitian page, and for the Help Me With section, choose the lung and in brackets respiratory drop-down option, as you can see here.
So the first one, Christy, I'll present is, does having a lung disease go hand in hand with irritable bowel syndrome?
So there's no evidence to suggest that PF causes or is associated with irritable bowel syndrome or IBS. But as we've discussed today, people taking anti-fibrotic medications such as pirfenidone and nintedanib often experience things like nausea and vomiting and diarrhea. So if this is something that's impacting you, try and implement some of those suggestions that I mentioned today. Although in saying that, about 20% of Australians have IBS, so you could be in that category. And if that is something you fall under that, I would recommend seeing a dietitian, as there is a specific diet called a low FODMAP diet that they may want to discuss with you, although it is restrictive, so it's not something for everyone, but it is another option. Just to sort of detail, the inflammatory bowel disease, or IBD, is a different type of gastrointestinal disease. It's things like Crohn's disease and ulcerative colitis. There has been a link between COPD and IBD, but no no specific link between PF at this stage. So I was just sort of referring to IBS, which is more of a general disease.
Okay, excellent. Thank you. So the next one, I have noticed my anxiety increases my symptoms, including coughing. Is there anything that I can change in my diet to help?
Okay, so anxiety and depression are quite common in Australia, but they are more common in PF. And the reason that's important is that it has been linked to coughing and breathlessness. So if that is something that you are experiencing, again, I would recommend using the strategies that we've discussed today, specific to breathlessness, to help with that and coughing. But it's also worthwhile to check in with your GP or psychologist to try and treat the anxiety itself, as that may help the breathlessness and coughing on top of that. And anxiety has also been linked with irritable bowel syndrome. So it's, I guess, another reason to try and manage anxiety.
Excellent, thank you. So I'm just combining a couple of questions here because they are quite similar. So firstly, is dairy a good choice or does it make more mucus and phlegm? And secondly, how does nutrition affect mucus and phlegm in emphysema and IPF?
Very common question in all respiratory diseases. So there was actually a study that found that while the texture of milk can make some people feel like mucus and saliva is thicker and harder to swallow, there's actually no evidence to suggest that it leads to excessive mucus secretion. It's more just a mouthfeel and trouble clearing. But we know that dairy is really important. So dairy, including milk, it provides us with things like protein and calcium and other vitamins and minerals. And we actually need about 3 to 4 serves a day, as we've found out today, to meet our 1,000 to 1,300 milligrams of calcium a day. And if you eliminate milk, it can be really hard to meet that calcium intake, and it can increase your risk of osteoporosis or progression of osteoporosis. So it would be something to chat to your doctor about if you wanted to eliminate milk, and your dietitian if you're seeing one as well. But to be honest, there's no evidence. It's more of a feeling that people report.
Okay, excellent. Thank you. So this one's just around any advice on the sort of pre-packaged or frozen meals or programs that are out there, and are they as nutritionally balanced as they say they are?
Yeah, this is becoming a much bigger area and a bigger business. There are a lot of home meal and grocery delivery options, particularly in the times of lockdowns and isolation. So the variety is much better now than what it has ever been before. And I'm sure that you would be able to find something that met your nutritional needs and taste preferences. And they can be a really good option for people that struggle with mobility or need to rely on other people for meals and groceries. There would be no issue with that. If you had multiple medical conditions where you needed certain restrictions with your diet, then that would be when I would be chatting to the company if possible, or going through a dietitian to work out what one was the best for you.
Okay, excellent, thank you. Okay, so we might leave it there for today for the Q&A, and I know you've done an amazing job in incorporating a lot of those frequently asked questions that have come through as well, so thank you so much.
No problem, thank you for having me.
Thank you, no problem. Before we do finish up, I will just take a moment just to let everyone know about the resources that we have specifically for PF and IPF patients. So these include all of our webinars that are recorded from previous series as well, digital booklets and fact sheets. So these can all be accessed on our website, I've got the arrows leading to sort of the tabs there that will help you to direct you to these. You can always call our information and support centre as well. That's the number that you can see on the screen there, which is free call 1800 654 301. And we do have some really amazing peer support options available, specifically designed to connect people living with PF and IPF right across Australia. So these include the telephone-based Peer Connect service and the IPUF online support network as well. So you'll see on those flyers on your screen there, you've got the QR codes. So if you scan those on your phone, they'll just take you directly to the expression of interest form, and we'll be in contact from there. But again, you can access these from our website or the Information and Support Centre as well. So thank you again, Christy, for joining us, and everyone else who's joined us today also. We really hope that everyone listening was able to gain something from today's webinar. So with that, I will say goodbye and close the session for today. So thanks, everyone. Bye.